Ladies and gentlemen, thank you for standing by and welcome to Communicating with the Public in a Radiation Disaster webinar sponsored by the National Alliance for Radiation Readiness. During the presentation, all participants will be in a listen-only mode. Afterwards, we will conduct a question-and-answer session. At that time, you may press the 1 followed by the 4 on your telephone keypad to register for a question. You may also use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, you may press the *0. As a reminder, this conference is being recorded Tuesday, July 30th, 2013. And I would now like to turn the conference over to Leeanna Allen, Health Education Specialist with ORISE. Please go ahead, ma'am.
Good afternoon, everyone. My name is Leeanna Allen. I'm a Health Education and Communication Specialist with the Oak Ridge Institute for Science and Education. And for the past almost 5 years, I've been working with the Radiation Studies Branch at CDC on various health communication and education projects related to radiation emergencies. And I'm thrilled to be talking to all of you today, and I'm thrilled that there are so many of you on the call. So I hope that what I have to share will be a little bit about what we've learned about communicating in radiation emergencies over the years. What I'd like to do today is to provide you some background on the unique aspects of communications in these types of events, and then talk about how to communicate more effectively. And I'll be using some focus group research that CDC has conducted with over 300 people in 11 cities nationwide, as well as some lessons that we learned in the Fukushima nuclear power plant response. Finally, I'll close with some additional resources that will hopefully help you as you think through some of these challenges, and then I'll be happy to take any questions or address any concerns that you may have at the end. So radiation disasters are unique in large part because of the public's intense fear of radiation. As many of you know, unlike other threats, radiation is invisible, silent, it's odorless, and can only be detected with specialized equipment that doesn't look familiar to many of us. It's also not well understood by the public. Even common medical procedures that involve radiation are often referred to in terms that mask any reference to radiation at all. And there's also a strong sense of fatalism regarding radiation disasters. People just don't believe they're survivable. And even those who may survive the initial disaster fear possible long-term and delayed health effects like cancer, many of which can only be diagnosed years after the exposure. Also, unlike other types of health emergencies, people generally don't have the background knowledge on radiation that they may have with other subject areas. And I'll give you an example. This is somewhat of an oversimplification, but if you're communicating information for, let's say, flu prevention, more people have a general sense of what the flu is. You've got a larger percentage of the population who has had the flu or knows someone who has, and more people are generally aware of its symptoms and how it spreads and what treatments are available. With radiation, the knowledge base just isn't there as much. Many times when we ask people, what do you know about radiation? We hear people talk about superheroes or supervillains. People talk about three-eyed fish, mutants, or disasters so horrible there's just no hope for survival. This has a real impact on how receptive people are to information, both before and during a radiation disaster, and what hurdles communicators must overcome to really get our message out. But effective communication in radiation disasters can go a long way in aiding response efforts. For instance, in the case of an improvised nuclear device or an IND event, we can save lives if we can communicate to the affected populations to stay inside for at least 24 hours. Communicating factual information about radiation and its health effects can reduce rumors and also provide reassurance. I remember seeing an article during the response to the Fukushima nuclear power plant incident that was talking about how China deals with rumor control. There was a blogger that was encouraging people to stockpile and consume vast quantities of iodized salt to combat the adverse effects of iodine-131. And in China, he was jailed for 10 days and fined the equivalent of about $75. Now, we don't have that ability for rumor control here in the United States, but getting the message out in front of the situation using multiple trusted sources that have good communication can go a long way in reducing rumors. Communications can also direct people to a community reception center to be surveyed for radioactive contamination instead of to an overcrowded or overwhelmed emergency room. Much of the U.S. response to the events in Japan a few years ago was really a communication response to public concern and trying to explain the risk and the radiation levels that were detected. So as in all communications, knowing the needs of your target audience is really a main driver of your plan and strategies. The need for knowledge and information after a radiation or a nuclear disaster will be huge. Just to give you an idea of interest, the Japan earthquake tsunami nuclear power plant emergency generated, on average, our radiation emergencies website at CDC gets a few hundred hits per day, some days more, some days less. But a few days after the events happened in March 15, 2011, the website was getting over 90,000 page views a day, and that number kept going up. Communicators will need to balance the information needs of the impacted area with those outside the area. It's possible that the methods available to deliver communications may be very different for those audiences. So you'll have to adapt your message to maximize its effectiveness with the technologies that you have available. For CDC, two of the main target audiences are public health professionals and clinicians. These groups are also trying to serve their constituents, their jurisdictions, their patients, and so we want to provide them with the best information we can so that they can serve as a force multiplier for communications. They'll be called upon to provide information, to answer questions, and especially with a relatively unknown topic like radiation, the importance of message consistency is even greater. One of the silver linings of radiation communication that we have is you don't really have to worry as much about making the information that you're communicating too basic. Professionals are going to have many of the same questions as the public, so the messages that you create will be appropriate for multiple audiences. Many times, especially in radiation emergencies, the main concern of the public is, am I safe? If I am, how do you know I am? And if I'm not, what can I do, or what are you doing to make me safe? And this question doesn't always have an easy answer, particularly when we're talking about radiation. How much of the technical content do we need to provide for people to make informed decisions about their risks? And how can we talk about radiation in ways that promote responsible public actions, such as reporting to a community reception center to be surveyed for contamination, instead of actions like consuming mass quantities of ground kelp for protection against low levels of radioactive iodine, like we saw in some West Coast communities in the United States after the nuclear power plant incident in Japan. After a radiation emergency, one of the best things that we know people can do is to get inside, and stay tuned. So, will people do this? How can we use communication to maximize the effectiveness of this message? And what questions will people have? And this was something that CDC wanted to find out. So before I get into some of the lessons that we've learned from our research, I just want to give you some background information on how we gathered this information. I'll be referencing findings throughout the slides from a few different projects. So just to give you some background on one of the studies, in 2010, the Nuclear Detonation Response Communications Working Group, which is an interagency group of communicators and radiation technical experts, came up with some key messages for affected communities as well as the rest of the nation that could be used during the immediate aftermath of an improvised nuclear device detonation. CDC was part of that group, and to help ensure the quality of those messages, CDC tested some selected messages with the public. We did 2 rounds of this. The first round in January 2011, We went to 5 cities, New York, Washington, D.C., Chicago, Houston, and LA. And we tested protective action messages that focused on sheltering, evacuation, food, water, and air safety, and self-decontamination instructions. We followed that up with a second round in October of 2011 that focused on the health effects of radiation emergencies, and we went to Boston, Atlanta, Denver, and Seattle. The next study I'll also be referencing, we followed that up with some telephone interviews with some breastfeeding experts. The Fukushima nuclear power plant incident raised a lot of questions both here and in Japan about breastfeeding during a radiation emergency. So to get a better idea of what the needs of the breastfeeding community might be, we talked to some pediatricians and lactation consultants. And we also talked to nuclear medicine technologists to get an idea of what guidance and instructions breastfeeding mothers who undergo nuclear medicine tests are given, so we could try and see what kind of information is out there. Most recently, we've tested some translated versions of those protective actions and health messages with Spanish-speaking populations in Miami, Florida, and San Diego, California. So as you view these next few slides, I just wanted to let those of you know that the italicized text that you'll see in that orange-yellow color are actual quotes that we've pulled from people who participated in the audience research. So here are some things that we learned that were true in all of the focus groups and all of the interviews that we've done that we really believe are key to successful communications. Many of these are just basic good risk communication practices, but they're of a special importance in a radiation or a nuclear emergency. So the first thing that we heard over and over and over again from people is any message needs to give me something to do, to give prioritized action items in each message. People really responded very positively to messages that provided them with simple action items that they could perform to protect themselves, their families, and their homes. Even if providing specific action items made a message a little longer than communicators would normally try and develop, we found that for the most part, people were able to keep up with it as long as it stuck to things that people could do. Participants also reported that if you're giving out safety instructions, we need them for all the different places that people might be. A lot of the guidance was mentioning multi-story buildings, but participants said, well, what if I'm outside? What if I'm in my car? What if I'm on a bus or a mall or in a single-story house or an apartment building? We also found that with the self-decontamination instructions, those instructions talked about the importance of showering, if you had a shower, and then it talked about if you don't have a shower, here's what you can do, and if you don't even have water, here's what you can do. And people responded really positively to that because for many of them, they didn't think there was anything they could do in a radiation or a nuclear emergency. The tone of the messages, people wanted the tone to be very direct and very authoritative. When we tried to talk about why you should do a certain action, people said, you know, I don't need to hear that. Just tell me what to do. The only exception to that rule is if the actions that you were trying to get people to take were counterintuitive to what they would normally do. For example, we had a message that talked about the importance of not leaving your building or your home to go and get loved ones who may be at school or at hospitals or at daycare or elder care facilities. Your instinct is you want to go get your family, but that's not the best thing to do in this situation. So while we had some people who said, you know, I don't really care what that message says, I want to go get my kids from school, we had many others who said, as long as I knew that the schools had a plan, that the hospital had a plan, that the nursing home had a plan, and they were keeping everybody safe, I'd be more likely to follow that instruction, but it would be hard. it may be really difficult to think of how to provide a sense of hope, which people also wanted to hear during such a scary event. But in our research, we found that this could be as simple as including a statement that said, health officials will be monitoring those affected by the disaster for any health problems in the future. And this really reassured people that there would be a time for them to get seen by experts and have all their questions answered. And again, providing those action items for people to do that they could do themselves to keep themselves safe also provided that sense of hope, that there was something that they could do and it wasn't a hopeless, fatalistic situation. The next thing that's really important is to not use contradicting statements, whether those are actual contradictions or if those contradictions are just perceived. And I'll give you an example. One message we used was trying to use the analogy of infectious disease to explain radiation contamination. And what the message was trying to illustrate was that while radioactive materials can be spread, radiation exposure itself is not contagious. And this really confused people, and they felt that the message contradicted itself with, well, if it can spread, it's contagious. The old saying, perception is reality, really holds true here. And if people believe the message is contradicting, then it is. And they may be less likely to follow the instructions. So identifying those perceived or actual contradictions within messages is a critical piece for communicators. And this is one way that message testing, whether it's a formal study or just an informal asking questions to people who aren't familiar with radiation, can help to show where people may be having some trouble with your messages. Another thing that we learned that was important for us to do is to use plain, non-technical language. People were also often confused by technical terminology, and many people, again, were unfamiliar with radiation, and they liked examples and analogies. They liked how we could describe radiation contamination as settling like dust, and you don't want to track dust into your home, so it's the same principle. While defining those technical terms could be helpful in some situations, if that technical language can be avoided at all costs, especially in that immediate time frame after the incident, we recommend that you try and do so. Another thing we heard from people over and over again was that the messages need to be short, concise, and simple. We often heard, this message needs to be shorter, but tell me more. So you have very little real estate with your message, especially right after an emergency. So every word needs to be chosen very thoughtfully. And no SAT words. We heard that over and over again as well. Participants also had different information needs based on how much time had passed since the incident and how far away they were from the emergency. They said, you know, depending on how much time has gone by or how far away I am, my information needs are going to be different. So parts of your message may or may not be relevant to them depending on their distance from the blast or how much time has passed since the event. Segmenting messages by distance from the blast or the damage zone or affected or unaffected area. This is one area where maps and visuals could help people to better understand their risk so they can determine what the best thing for them to do is. In addition, people wanted to hear different messages depending on the delivery method. Obviously, a message communicated via a tweet is going to be written differently than a message on a press release or on a website. And providing those messages through as many channels as you have available to you will be important in order to reach all of your audiences. However, with the many different ways that people receive your messages, it becomes even more important to do everything you can to ensure message consistency and to avoid those perceived contradictions that I mentioned earlier. People also really wanted to hear messages that were tailored to their specific communities. For example, when we tested messages in Los Angeles, messages about going to a basement to shelter didn't go over very well because a lot of people in Los Angeles don't have basements. So we heard, I don't think this message applies to me. It's telling me to go to a basement, and we don't have basements here. In New York, when we were saying that the power might be out, but you could still use water to decontaminate yourself, we heard we live in high-rise apartment buildings, and the water gets pumped up to the high floors. So when the power goes out, we don't have electricity. So it's important for communicators at the local and state level to take a look at the characteristics of their particular community to be able to adapt messages to the specific characteristics of the people they're trying to reach. We also ask people, who do you trust? Who do you want to hear from if something like this were to happen? And what we heard was that knowing that radiation specialists and experts were informing guidance was something that was reassuring to the public. They wanted to know that there were scientists working on this and that it wasn't being driven by politicians or elected officials, although they certainly expected to hear from their elected officials. We asked people, is there a particular person or type of person that you'd especially want to hear from that may make you more or less likely to follow protective actions and instructions? And we heard, the mayor, the governor, the president, fire chief, police chief, things like that. But what we heard over and over again that was more important was that they wanted to hear from a live person from their community. And regardless of who that was, it just needed to be a live person. Hearing that live voice provided reassurance that other people were alive and other people were out there. We also asked people if they had a battery-operated or a hand-crank radio. And if that was the only way to get information, would they be able to stay informed? And the news really wasn't good on that front. We had about 10 to 20% on average of people who had access to either a battery or hand crank radio. For the West Coast people, Los Angeles was a little better off, and they all mentioned that there had been a lot of public media campaigns encouraging people to be prepared for earthquakes, so it looks like that's paid off a little bit, but still it wasn't a majority of people who would have a battery or hand crank radio available to them. Any emergency response is going to require some additional considerations for those groups with special needs, and radiation disasters are no different. Of special consideration in radiation emergencies are pregnant women, nursing mothers, and children because of the greater risk of health effects from radiation for these groups. Non-English speakers will also require targeted communications to ensure that they know what protective actions to take. And those persons who rely on assistive technology or service animals for mobility or other needs may need specialized instructions when it comes to decontamination. Community all hazards plans will be useful in identifying and addressing the needs of special populations, but I'd like to point out a few radiation-specific things that we've learned about communicating, in particular with nursing mothers and non-English speakers through some of our research. So one of the things we've learned is that nuclear medicine procedures are a rare occurrence among breastfeeding mothers. Most mothers either try to avoid them or defer those tests while breastfeeding. And nuclear medicine technologists provide most of the patient education and consultation before, during, and after a nuclear medicine procedure, but the amount and format varies widely. We heard that nuclear medicine technologists reported that they've had mothers come down who had no idea that the test that their doctor ordered involved radiation and were completely unaware of the risk. Nuclear medicine technologists sometimes just did patient education verbally. Some used handouts. It really varied widely depending on the test. In a radiation emergency, pediatricians and lactation consultants are the most likely to be contacted by lactating mothers who may be seeking some advice. But the nuclear medicine technologists are often involved in hospital planning for radiation emergencies. We asked our pediatricians and lactation consultants, if something happened today, and given what you know now, which they've all admitted was not a lot about radiation, and you had a mother call and said, should I keep breastfeeding or should I stop? Tell me what to do. We said, what would you tell her? Just knowing what you know now if this had happened today. And we had about half of the pediatricians and lactation consultants say, I'd tell her to stop until we know more. And then the other half said, I'd tell her to continue until we know more. So there's quite a need for some information and guidance in that area. We also learned that many mothers may only have supplies, whether that's formula or stored breast milk, to last a day or so, and that professionals really wanted some practical steps they could provide to lactating mothers on how to safely feed their children and some tools that would help them better understand as professionals the effects of radiation on breastfeeding mothers. One of the interesting things that CDC found in some focus group research that we did was that with many Spanish-speaking audiences, depending on where you're from, your vocabulary may be very different. One thing that we've learned is in using the analogy with radiation contamination being like dust or mud, is that doesn't always translate well because there are so many different words for dust or mud in the Spanish language, and depending on where your Spanish is from, dust, the word for dust or mud could mean anything from some dirt on the ground to material that you build a house out of. So one of the things that we wanted to do, particularly with the protective action messages, was to get those translated and to see if there was anything else that we needed to be aware of if these messages were to be used in Spanish. What we found out was that the word building may be problematic because many of the Spanish speakers that we talked to didn't think that homes were an acceptable place of shelter, as instructions referred to getting in a building, and building and home were two very different things. We also had people who thought that the middle of the building was either just the middle horizontally or just the middle vertically. And so they wouldn't necessarily go to the center of the building to shelter. They also had trouble with the word for outside, and this was in relation to food safety. We were talking about how food outside shouldn't be eaten. And they assumed that meant food from the garden, but also food that was outside on the counter or outside on the shelf. And so there may need to be some clarification that particularly in IND event, food in pantries and cabinets and refrigerators will probably be okay to eat. When we talked to folks in San Diego, they were very worried about what effect a radiation or a nuclear event would have on the border crossing. They were really concerned that there's so much cross-border people live on the U.S. side and work on the Mexico side and vice versa. They were worried that they may get stuck on the wrong side of the border and wouldn't be able to communicate with family or friends in this type of emergency. And while we just heard that when we talked to San Diego folks, that concern is probably shared in additional border communities as well. Most of the terminology and technical language used to describe radiation is unfamiliar and unknown to the public as well as professional audiences. And the words on this slide will just give you a sample of some of the terms that people may have trouble understanding. For example, when we use the term downwind, many people thought that that meant south. So if we're giving instructions to people downwind of an event, that may need to be clarified. We also heard that when we use the term you need to shelter or it's important that you shelter in place, some people thought that that meant that they needed to leave where they were and go to a shelter, like a Red Cross shelter that they're used to going to instead of for tornadoes and things like that, which is not what we want them to do. So to avoid that confusion, we recommended that messages be changed to advise people to stay inside. In the absence of a frame of reference, and most people really don't have a very personal frame of reference for a radiation or a nuclear event, people use past disasters like 9/11 or Hurricane Katrina or earthquakes or wildfires or disasters that they were familiar with to inform their actions. For example, in New York City, we heard that if people were told to get inside, and stay tuned, many people would not follow those instructions because people in the World Trade Center buildings were given those same instructions on 9/11, and many of them died as a result. When we talked to folks in Houston and Miami, they were a little bit more accepting of the protective action recommendations because it was something familiar, because it's very similar to what they're advised to do in a hurricane. So as you're crafting messages and adapting messages for your particular community, adapting those to situations that are more familiar to your community, and then differentiating radiation in terms of, well, this is a little bit different than a hurricane, or this is different than an earthquake because we want you to do this, can help people better understand the hazard by giving them something familiar to hold on to. And that doesn't just apply to real events. We also have people reference movies, television, comic books. You know, I saw a movie and they scrubbed this lady down with a scrub brush, and so that's what I think I'd need to do. So it's important to be aware of not just real frames of reference, but fictional frames of reference as well. I wanted to also mention that the reports from a lot of our research projects can be found at emergency.cdc.gov/radiation/audience. And in addition, I want to encourage you to, if you haven't already, download the Improvised Nuclear Device Response and Recovery, Communicating in the Immediate Aftermath, which contains the messages that I referenced in the focus groups that we've been doing, both in English and Spanish, and contains many other messages that might be useful to you. There's a similar document that's recently come out as well called Communicating During and After a Nuclear Power Plant Incident that is also available. And both of these contain some pre-scripted messages in Q&A format that can be a good start as you craft your portfolio. I also want to encourage you, if you haven't already, to contact your state radiation control program. They've got some great resources to help you on any technical issues or questions you may have. If you're a person who's more on the technical side, finding out who the risk communicators or help communicators that you may have access to, they can also be helpful in helping you communicate your technical information in a way that people can understand. And of course, the NAR website has a wealth of information and resources available as well. CDC has got 2 radiation emergency toolkits, one geared towards public health professionals and the other towards clinicians. And both toolkits have all sorts of resources, videos, brochures, guidance documents, trainings, fact sheets, all sorts of stuff. If you already have a toolkit, and I think many of you do, or hopefully many of you do, we've added a few new pieces in the past year or so make sure that you've got the latest version, and you can find that out on our website. The clinician toolkit, if you work with hospitals or healthcare providers in your area, may also have some useful information as well for you. Both toolkits are free of charge, and you can order as many as you like. So to place an order, you can use the email and phone number on the slide. Be sure to specify how many of each toolkit you'd like. And in addition, many of the resources can be obtained directly from the website at emergency.cdc.gov/radiation. I'd also like to mention that we're very close to wrapping up a complete redesign of the Radiation Emergencies website. So those of you who may be familiar with going to the website may notice a few changes, hopefully sometime soon. We've redone the site to have more of an emphasis on the main question that people wanted to know, which is, what do I do in a radiation emergency? And it will have some graphics to communicate technical concepts, as well as hopefully an easier way for folks to get a hold of resources. We've done some testing on the site with both public and professional audiences, and we're really excited about launching it hopefully sometime soon. And we hope that you'll find it to be a useful tool as well. And we'll be sure to get the information out to the NAR when it in fact launches. On a final note, I'd like to close with a quote from Teepei Sato, who's a Fukushima fourth grader. And this quote's from a 2012 article in the New York Times about how science classes in Japan were incorporating radiation education into their curriculum. And he says, "I had kind of a scary image of radiation because it's invisible. But after I've learned about it, I know what to avoid and where not to go. And I understand the news about the nuclear crisis. I understand radiation better than my mother. And when we go to a supermarket together, I tell her what produce to avoid." And I think this really sums up what we're trying to do here, which is to communicate some information on a very technical subject to people who aren't used to hearing and aren't familiar with that subject in a way that they feel empowered to take actions to protect themselves and their family. In a radiation or a nuclear emergency, the expertise and knowledge of organizations like those who are members of the NAR is going to be such a critical part to providing those who we serve with the information that they need to help make the very best decisions for themselves and their families. And with radiation being a very technical and a very unfamiliar subject for many people, including our response partners that we work with, having good subject matter experts who understand communications and understand the challenges with radiation emergency communications is of the utmost importance. So with that, I'd like to close, and I hope that I've been able to provide you with a few helpful tips and maybe some resources. I'm happy to take any questions you have now, or if you think of something after this is over, I'd be happy to answer any questions you have later on. Once again, thank you all so much for your time and your attention to this important topic, and I will open it up for questions.
Thank you. Ladies and gentlemen, if you would like to register for a question, you may press the 1 followed by the 4 on your telephone keypad. You will hear a 3-tone prompt to acknowledge the request. If your question has been answered and you would like to withdraw the registration, you may press the 1 followed by the 3. And you may also use the chat feature located in the lower left corner of your screen to ask a question. One moment, please.
Hi, Leeanna. This is Meredith. We did have a question from the audience regarding if you have heard of the Milk and Honey group in Hawaii who suggested taking boron to protect one from radiation. They heard that boron was being used to dampen the reaction in reactor vessels.
Thanks for the question. I'm not familiar with that group. I think it's an example of, again, how important rumor control is in communicating in a radiation or emergency. And this is one of those things where it's so, you almost can't get your messages out fast enough, especially with social media. Things move so quickly. So one of the things that we learned is the importance of having as much information as you can up and available so that you don't have to worry about trying to create something new in an emergency. If you can pull from information that is already cleared and available, that can help out with rumor control. But I'm not familiar with the Milk and Honey group, but I'll have to look that one up.
Great, thank you. And we have another question from the chat feature. Considering this type of event might result in radiation patients being transferred to faraway places through NDMS, what strategies should be considered to effectively communicate to citizens about radiation patients coming into their communities?
Well, that's a really important question. As we're seeing in Japan, there's a lot of social stigma attached to people who have evacuated from the Fukushima area. So it's certainly something that we may have to deal with in this event, especially with patients particularly being transferred. And this is, again, one of those instances where your message for the affected area is going to be different for your message for the community that those patients may be transferred to. I think it's also a matter of getting community experts and respected folks in the community to buy into your message, to help you get out in front of it as trusted sources in the community. For example, if you've got folks coming into a local hospital, having the physicians be comfortable with those folks coming in. So when people say, aren't you worried about these radioactive patients, they can say no, and here's why. We use the example of of Alexander Litvinenko, who was the Russian guy who was poisoned with radioactive material. It took him a while to figure out that it was radiation, and just using universal precautions, doctors and nurses and other healthcare providers were able to stay safe. And so this is one of those things, what can you do? What's exactly the danger, and helping people to understand the risk in providing that education for the effective communities. The earlier you can do it, the better.
Great, thank you. I did also want to let everyone know that the slides in the presentation will be available on radiationready.org. Probably give us a couple weeks to get it online there, but it will be made available as well. And we have another question from the chat feature. How can we improve communications through between those monitoring and those communicating risks to the public? How do we know who is monitoring what?
In terms of monitoring the event itself or radiation levels?
The question said that it seems like there are multiple agencies that monitor but no centralized repository of data, so the actual event itself.
Yeah, the data, communicating the data is always a problem, particularly in radiation emergencies, because it is so spread out among different agencies. And the public isn't always receptive to the message, oh, well, that's a different department, you'll have to ask them. I think this is one instance where the answer to the question is really in terms of planning and coordination prior to an event. After the event happened, it's almost really too late. So coming up with a plan of how data will be shared and who will be communicating and how will all of the agencies get the same message out is going to be a challenge, particularly when you're talking about multiple agencies on the state, local, and federal level. And you may end up having some disagreements as well. So I think once it's during the event, it's almost too little too late. But this is something where coordination and planning prior to an event and getting communication channels and data channels set and practiced and exercised is the solution to that issue. But it's definitely a problem, and one that I think is harder in radiation emergencies than other types.
Thank you. Are there any questions on the phone from the operator?
Unfortunately, we have no questions over the phone lines. However, as a reminder, it's the 1 followed by the 4 if you'd like to register for a question. Okay, and pardon the interruption, we do have a question coming in from the line of Edward Tupin. Please go ahead.
Yes, hi, this is Ed Tupin. Just want to follow up on that last. In a domestic radiation emergency, there is an entity known as the Federal Radiological Monitoring Assessment Center, which is charged with maintaining kind of a centralized repository of the data insofar as is possible. So I think you will find a little less disjointedness in the data than what occurred during Fukushima. Thank you.
We have additional questions from the chat feature. Some folks indicated that they're still getting questions about radiation risks from Fukushima. How is CDC communicating about Fukushima now?
We're referring questions from people heading to Japan who may have questions about the area. Those are being handled through the CDC Travelers Help website and specific country information. And all of the communication materials that were developed for Fukushima itself in terms of risks to folks in the United States are still available on the CDC website at emergency.cdc.gov/radiation.
We also had a question about how to get people to evacuate when necessary, seeing that lessons we've learned from Katrina. How is evacuation communicated with the public?
In terms of how evacuation is communicated with the public, it's something that the research that we didn't focus a lot on because it's going to be so location and community specific in terms of available infrastructure and evacuation routes. I know that there are several cities and localities who are working on some plans for how they would evacuate the city in the event of something like an improvised nuclear device. Our research really focused on getting people to get inside and stay tuned for that information, and expecting that with the exact details to come into play, that local and state officials will be providing the details. People were concerned, however, about the contamination issue, and so we have done some testing with some messages about decontamination and monitoring for health and where people need to go to get checked out if they're concerned. And that's certainly a big concern, and I think something that will need to be addressed sooner rather than later in communications regarding evacuation.
Thank you. We also had a question about the breastfeeding recommendations. If you could provide a little bit of information on what you found there.
With regards to the recommendation in terms of whether or not to breastfeed, we're still trying to come up with a good idea of what the guidance exactly should be, depending on the particular isotope or the particular levels, and that's something that's in progress. But I think in the meantime, what we're communicating is that if you think that you may have been exposed, you may want to contact your physician. If you're not sure, you may want to consider stopping breastfeeding, but if there's no other way to feed your baby, don't stop feeding your baby because of contamination concerns. And we're hoping to get some more communication and guidance written and created and out very soon.
Thank you, Leeanna. Are there any other questions from the operator?
At the moment, we have no further questions.
I'm not seeing any other questions on the chat feature. So Leeanna, I'd like to say thank you so much for the presentation. And if any additional questions do arise, please feel free to email Leeanna directly or myself, Meredith Allen, with ASTHO at mallen@astho.org. And without, if we have no other questions, we'll end the webinar.
Thank you, ladies and gentlemen. That does conclude today's webinar. We thank you for your participation and ask that you please disconnect your lines. Have a great day.